Ladies and gentlemen, boys and girls, children of all ages, citizens of crypto land, welcome back to another AMA with myself, TheGobOne, and with me this time I have got Lucas and Kat from SimplyVital Health. Thanks for joining us, guys. I might have accidentally forgot to unmute your guys' sound, so maybe nobody heard you, but it wouldn't be a live stream of the Goblins without messing up. So if you guys are new to the AMAs, please start your questions off with capitalized questions so that our mods can pick it out. Also, I'm going to read my lovely disclaimer for you guys just so that you know and are prepared for what you're about to see. So this is not financial advice. I'm not a licensed or professional financial advisor. I've not received any compensation of any form for this interview. This allows me to maintain integrity and conduct a fair and unbiased review. Any comment or statement on the value of the company's token or token sale is solely the thoughts and speculation of myself. All right, disclaimer down. All right, guys, let me make sure no one's screaming echo at me in the live chat. It looks good so far. I think we're right on track. All right, why don't we just go ahead and dig right in. Since there's two of you, why don't you guys kind of introduce yourselves and we'll start off with that.
Sure. So I'm Kat. I'm the CEO and co-founder of SimplyVital Health, and I have a master's in public health background in healthcare as well. Most recently, I left my full-time job at Yale New Haven Health System to launch SimplyVital Health. There, I worked in the Center for Musculoskeletal Care, where I focused on everything from clinical to financial analytics to operations of the center. Before that, I had spent 2 years as a strategic planner where I focused on growing the market share for the medicine and surgery service lines for the entire health system, which is comprised of 3 hospitals, a physician group, and many, many ambulatory locations. Yale is the 6th largest hospital in the United States. Before that, I worked at a community health center, which is it serves the lowest income population. Most of the people that go to a community health center are seeking free health care. I designed and led the development of a care management dashboard that they still use every day to round on their patients. And I'm a Teach for America core member, which is more selective than Harvard Law.
Hi, I'm Lucas Hindred. I'm the CTO and co-founder of SimplyVital Health. I double majored from the University of Illinois in electrical computer engineering and physics. While there, I did a lot of undergraduate research with 2 research groups. I got published twice, once in Nature for my research in nanotech, and a second time in the Biophotonics Journal. My specific research in that was writing computer vision software to help analyze and do predict analytics on cell layers in your eye. On top of that, I entered into a lot of competitions, built my own operating system from scratch and placed an Intel competition. Also wrote computer vision software for a NASA JPL competition, which I placed. After that, I went to work for Capital One. I very quickly became a tech lead of different blockchain products in Capital One. I worked on R&D teams, so I worked on a lot of different teams as well. I did stuff in AI and web development, but my big experience was tech leading blockchain products. After a while, I realized I really wanted to dive in more into it. So I started looking around online. I quickly met Kat, and we met in person at a hackathon, Distributed Health in Nashville, which is where we ended up winning and building kind of the first iteration of our system. Fun fact is I officially got introduced to blockchain around 2012. I came back from winter to visit family in Denver and found out that my family had moved past me going to college very quickly. They converted my room to Bitcoin miners and we're heating our house with Bitcoin mining, which was very effective. It was very warm.
Wow, really?
Yes, it really worked.
At least you have a very technical founder, and that's good to hear. Okay, just for people watching, we're going to kind of move along quickly. Unfortunately, Kat and Lucas have an emergency meeting that came up in about 45 minutes, so I may push through some stuff, but I think we'll get the message across for sure. So you guys covered your background and basically what caused you guys to want to create SimplyVital Health.
Yeah, so the story is, so the entrepreneurial journey for me, I think, is what spurred the SimplyVital Health, and then we came together and pushed it forward. So for me personally, I was working at Yale New Haven, and it was around December-ish 2014, and I had moved through my work really, really quickly. I quickly became the tech lead as well, but on the liaison side, so between the customer, which is the C-suite of the hospital, and our department. So I mastered our tech really quickly. I mastered our analytics really quickly. I created a lot of new things in the department, created a lot of new dashboards, and was trying to find other things in the health system and kind of a direction to go. And it became very apparent that that I was moving faster than what they had in terms of opportunity. So after a very long introspective journey, I figured out that being an entrepreneur was actually more at the root of what I wanted to do, and how I always talked about my career when I was in college. So then that began a 1.5 to 2 year journey of research that is the foundation of our company. I think that's a big differentiator in the space, is that we've been putting the rails of this and kind of the idea behind this for well over 2.5 to 3 years at this point. And that was interviewing between 150 to 200 administrators and physicians and nurses in the US and abroad to figure out exactly where we wanted to go. The tipping point, though, was when I was working at the Center for Musculoskeletal Care, and I needed our first existing product that we have right now, which is revenue generating. It's our Connecting Care product. It was a very strategic entry point into the blockchain and healthcare space. At that point, I had already met Lucas, and we already knew that we were moving forward with SimplyVital Health. We hadn't yet named Health Nexus, but the earliest code of Health Nexus you can find from that hackathon. So it really started with this entrepreneurial journey and desire inside. He just talked about as well working at Capital One and kind of feeling like there's something more that he wanted to do. So we're very parallel in that desire to kind of build something and be a part of something that's greater. And then there was a market need, which is why we attained revenue so quickly. And then very quickly was able to validate the reason why we needed Health Nexus. We in healthcare needed Health Nexus, and have been running ever since.
So just to clarify, Connecting Care and Health Nexus, I guess, just so people know what you're talking about, what's the relationship between those two? Yeah,
so this is a very important distinction. So think of it as two arms. So SimplyVital Health is the corporation. It's the DApp builder, the service provider of the open source, free to build on Health Nexus protocol. So think of Health Nexus as the Ethereum of healthcare, open source and free to build on, but someone has to build those rails first. SimplyVital Health Inc., the corporation, is building the rails of that protocol. SimplyVital Health Inc. already had an existing product in the market. So again, SimplyVital Health is a DApp builder and service provider. Connecting Care is one of our first dApps.
Okay, understood. Yeah, I just wanted to make that distinction so people understand the difference between the two things. But as you said, Connecting Care, you guys are already generating revenue. And I think I saw in another video, you talked about how you got to revenue or profit like record time. Wasn't it something like 7 months?
Yeah, we attained revenue within 7 months. Most healthcare companies, it usually takes 12, 18, some 36 months to attain revenue.
And 7 months, wow, that's amazing. Okay, let's maybe kind of, I hate to do this and it sounds bad, but let's maybe kind of brush over the team members. There's all the info about your guys' amazing team members are all on the site, and the advisors, everything's there for people to take a look at and have a look at. So maybe that's kind of where we'll cut a little bit of time here. And in that case, let's kind of go right into the deeper dive of SimplyVital Health itself. So first question my tech guys always have me ask is, has your smart contract been audited?
Yes. Our utility smart contracts were audited a while ago. They're available on GitHub. You can view the audit report, which is through Hosho, and you can view the code yourself. You can also test the code out. Currently, we have deployed on Rinkeby and are doing private testing. We're also we haven't done the updates yet, but we're working on releasing some tools with it. So we're doing testing for that on Rinkeby, but all that's available online. Currently, for the crowd sale itself, those contracts are online. They're in the process of being audited. As soon as those are done being audited, we will announce it. Mm-hmm. So utilities done. Smart contract for the sale are in the process. Should be done very soon.
Mm-hmm. What's the link to the GitHub? I just don't see it on the homepage. Maybe I'm missing it here.
Oh. healthnexus.github.com /DRS.
Okay. I'll get that afterwards and just throw it in the
we'll send it to you.
Okay, perfect. Okay. This is sort of a general high-level question, and for me too, because this isn't my area of expertise, but what is HIPAA and what does being compliant mean for a blockchain?
Yeah. Okay, so I can start. I just sent you the link. Okay. So HIPAA is at the highest level is it's a security protocol around the movement of healthcare data. The irony behind HIPAA is one of the P's in HIPAA is portability. The reason behind HIPAA is actually to facilitate the transfer of data in a very secure way. It's globally recognized standard. It's one of the more and most rigorous standards around the movement of healthcare data and the utilization of healthcare data. And Lucas will talk about what it means to have a HIPAA compliant blockchain.
Yes, so HIPAA compliance is really around the data itself. And kind of, it's around the data itself, it's around how the servers operate and who has access and the server security. So by being HIPAA compliant, we've ensured that all the data is safe and secure. However it interacts with blockchain, it is safe. We've also ensured that the nodes themselves are operating at a certain level of security. So that's kind of the two big things to really maintain HIPAA. You can really get in the weeds. The HIPAA documentation is fairly long. But those are kind of the two big things we're doing to ensure security for a blockchain.
And this probably goes without saying, but we're not putting medical data on the blockchain. I think most of us in crypto and blockchain recognize that blockchain is not a data storage. We have a different avenue for actually governing access to data. Yeah,
that's the big one. We are looking at decentralized storage solutions down the line, which are in a white paper, but that's at least 2 years off. And we, depending on how things go, we're going to do what we view as the best way to integrate it at the time.
Mm-hmm.
Yeah, I think that's the discussion we've had as well too. Then the big red flag with a lot of other ICOs is, you can't store this data on the blockchain. It's not ready yet. There's not an enterprise solution for that. Yeah. There's security and all kinds of things that aren't quite there yet. So I'm glad that you guys brought that up. Okay, one thing I kind of skipped over, I want to go back. Do you guys have any, it's a hot question, but do you have any crypto and non-crypto comparables that you can kind of give people an idea of how you match up against some of this other stuff, if you know?
In terms of healthcare, in the healthcare market?
Yeah, kind of what you guys are trying to do. Personally, I think you guys are one of a kind, but I think there's a lot of people who think, oh, it's similar to this, it's similar to that. So maybe touch on that if you can.
Yeah, we'll speak to the nuances. So thank you for kind of dissecting and realizing the nuances. So I saw a couple of questions come through, like, how are we going to displace this? How are we going to displace that? A lot of questions about Epic. So I'll start with how we're different in the crypto space and blockchain space. So we're a protocol, we're infrastructure. We're creating a healthcare safe blockchain protocol. A lot of the other medical companies or healthcare companies that you see in the blockchain space are apps. They're decentralized applications. So think of us like the operating system, the true open source, free to build on rails that other people can build on top of. So that's the major differentiation in the crypto and blockchain space. We've only found one other company that's anywhere close to that. But if you dig into the white paper and really dissect it, we really are further ahead in terms of developing the protocol and establishing industry relationships, which will continue to push us forward. In terms of how we compare to the non-blockchain space, so specifically with healthcare, it's really important to remember that blockchain in general in any vertical is not what I like to say, it's not completely disruptive in the fact that it's going to completely displace a lot of technology. We are not looking to displace Epic. We are not looking to be an electronic medical record. When you think about blockchain and healthcare, the same way it plays in other verticals, it is simply another layer, another infrastructure that you can use, that you can leverage, that augments, enhances existing technology. So when you talk about Health Nexus as the protocol, there's obviously nothing like that in the healthcare space. When you talk about things like our Connecting Care DApp or the Marketplace DApp that we want to build, we're also speaking with two Harvard physicians. We're forming a joint venture with them to create a behavioral health decentralized application. They'll be one of the first in our protocol. There are similarities within digital healthcare tech and some specific nuances that are really, really specific to healthcare. But our Connecting Care platform, the reason why we were able to attain revenue within 7 months is, first, I needed it when I worked at Yale New Haven and I couldn't find it. We had just canceled a contract midway through, a $3 million contract with another incumbent in a similar space because they weren't delivering. And so before we canceled that contract, I had done all the research to figure out what other products were out there. And so I knew the exact weakness in the market, and that's why we attacked that particular market with Connecting Care and attained revenue so quickly. So Connecting Care is one of its kind in the market as well.
Sorry, I muted my mic as usual. There was something, when I first talked to Lucas, there was something that really stuck with me on our phone call. And he said that, you got exactly what you guys said. You're not here to displace and disrupt and displace entire systems. You're basically going to wedge yourself into where the pain points are across this entire infrastructure. And I thought that's always stuck with me from the second I heard that. I thought that's the perfect way to play this. Instead of trying to blow everything up, you're supplementing it completely. So that's what people need to understand, that you're not here to replace anything. It's to supplement and increase value and flow through.
Yep.
Mhm.
Okay, question. Which clients do you currently have piloting your system, and can you give us any progress, feedback, updates, anything like that?
Yes, so we have 2 press releases so that you can read in more detail there as well, but it's with a health system in Connecticut and post-acute care network in Connecticut as well. The first one with the hospitals in the orthopedic department. The post-acute care network is working with the cardiac department. But what's really awesome is we just had a phone call yesterday with the hospital, and the hospital and post-acute care provider want to form a partnership. And since they're both using the Connecting Care, or we're in clinical implementation with the Connecting Care platform, this actually strengthens the opportunity for them to create a partnership, and we then become that bridge to help carry both of them forward.
Perfect. So just yesterday, you already guys having a partnership. Okay, that kind of let's go into that partnerships that you guys currently have. I mean, we kind of touched on it. We're at that spot, so let's maybe, if you can kind of flesh that out anymore, or maybe we actually already covered that.
Well, we have other conversations that we're in as well. So just to clarify, that was the sparked idea that we had with the hospital, since we're already with this post-acute care network and they want to strengthen the relationship with them. This is the way that they can do that because of the specific program that we focus on. That's an area of growth in healthcare, and using our platform, they can strengthen that relationship. Both of our leadership at both of those sites that we're working with have already had that conversation, and we're just taking it forward. So some other partnerships that we have, one is Athena Health, which is an electronic medical record company based in Boston. It's a publicly traded company. And the conversation there is strategic conversation on how they can leverage our Connecting Care platform in their marketplace, and then also how they can position themselves strategically to leverage health protocol and blockchain specifically. The other one that we're really proud about is we're the only blockchain company that sits on the Massachusetts Digital Health Council, specifically to help to design and build a distributed health network for the entire state of Massachusetts. So hopefully what we try to talk about often is strategy. We're a very strategic team. We're very thoughtful in partnerships that we create, and just the direction of the company. Creating an open source protocol was very strategic. It allows something like our relationship with the state of Massachusetts, as SimplyVital Health Inc., the corporation, we can recommend the open source protocol as a way to create that distributed health network. And then as SimplyVital Health Inc., we can help grow that protocol in the state of Massachusetts. So we're really excited about that one.
Wow, that's amazing. Yeah, maybe I'm missing that one on the site, but yeah, that's pretty amazing in my eyes. So okay,
sort of on that one. Not on the site yet.
No worries. Okay, let's go to the actual the protocol and platform itself. I kind of want to come at it from 2 ends. First at the front end, and then the back end with the miners, etc. So the front end, I know there's a question, and I wanted to ask it myself. So can you walk us through sort of the flow and how SimplyVital Health would actually be used, from a user standpoint, like somebody who's doing the paperwork, a doctor, a patient, etc., that kind of stuff. Maybe just a high level overview.
I'll start and you can do the tech.
Sounds good.
Okay, so I'll start from the healthcare point of view. So a reminder that Health Nexus is a protocol. So let's pretend, protocol is built, and we're going to take you through the perspective of a DApp that sits on top. So the common DApp that everybody wants today is the ability for healthcare data to be really easily accessible. So one thing that we have in our protocol is a key pair system. In the back end, Lucas will touch on that. On the front end, they do not know that they're interacting with blockchain. They do not know that there's a cryptocurrency or health cash that powers the entire system. All that they see is the opportunity and ability to gain access to data and grant access to data. So this could be a physician. I always like to use orthopedics as an example. This is a growing, with the aging population globally, it's a massive need to be able to share data more easily between orthopedic physicians and nurses and post-acute care providers. So orthopedic physician can grant access to a nurse, say at a home health agency, And then they now have a matching identity, matching keys, and then they can open up access and they see an aggregated view of the patient's data. To them, from the front end, it is an easy UI. There's no mention of blockchain because that just raises more questions. But in the background, it's a more efficient system.
Yes. So from the back end, the way that kind of works is that, so say I'm an orthopedics department and I need to give some specialist access to my patient's data to kind of better the care of that patient. What would happen would be I would generate a key for the patient data that's necessary. That key generation can look like quite a few things. It kind of can vary. But generally speaking, I create a key. I can permission that key. I then share the key to that other facility's wallet address. What will then happen then is whenever that facility then wants to get access to that data, that facility will send a message, send it to basically this gatekeeper sitting in front of the data. All the data can stay where it's currently stored. We are looking at providing another solutions down the line, but right now it can just stay where it's at. There's just a gatekeeper in front of it now. The gatekeeper will read the message, verify the signature is accurate, and then look at the blockchain at that address and see if it has the appropriate key and what the permissions of that key are. Once it has done that, if everything passes a check, it can then send the data back to the initial client or the initial the specialist who requested the data.
Okay, so there's some other, that's perfect. There's some other questions here in relation to the actual cryptocurrency itself. There's talk of validating nodes. Can you sort of go just a little deeper with the validating nodes? I guess a lot of people ask me, and I'll ask you, is this some sort of like a master node type system?
We're getting that a lot. So right now we're going to be a fork of Ethereum, so we're trying to go with Casper. Master nodes are something we are looking at heavily. The big issue right now, though, is that heavily affects token economics. We have some partners that are working with us trying to analyze what effect that will have on it. So that's something we're investigating, but we've not settled on yet, just because we want to see how that will affect the ecosystem fully before we make any announcements on it.
For sure, but right now it's a proof of stake protocol, right?
Yeah, based on Casper, or will be based on Casper. So we are looking at other things. It just kind of any small change there has a very large impact. So we really want to make sure any way we tweak that still works. Gotcha.
Okay, so this might sound kind of bad, but your timeline is sort of tied towards the Casper release. In terms of the blockchain, and I think but you guys are moving to your own blockchain, is that right?
Yeah, so we're starting off as an ERC20 token. The ERC20 token will have the keychain capabilities. We're moving to our own token for security and some other reasons. That will be in 1 year. So we're hoping things are further along in a year. It's also, if that doesn't happen, we have a few different options. But we're planning on transitioning to our own blockchain in 1 to 2 years. The reason it's 1 to 2 years and not just a year is because we needed 1 year to get the stuff we want on day one for a blockchain. We need about a year. That's the governance and security layers of the protocol. However, after that, we're partnered with Cooley. They advised us that we need to have our network grown to a certain size before we can officially launch it to comply with financial transmittance laws. So once the network is technically done, we need to make sure that we have enough nodes on day one.
Gotcha. Okay, so it's also a compliance issue as well as a infrastructure. Oh, that's good. I'm glad that you guys said that, because compliance is a big deal to me, and I think it should be to a lot of other people. So I'm glad that's in the forefront of your guys' minds. There's a question here about do the hospitals or users ever see or utilize the token, or in what sense would this sort of, I don't know how to ask this question, but is there anywhere where fiat would be replaced by a token that somebody on the front end would even see or use?
So first question is, so yes, they're interacting with the token, but they don't realize that they're interacting with the token. This is really important because someone put this question in. It's pretty obvious that healthcare is notorious for just technology in general can maybe scare healthcare. And so we don't want them to get put off by the fact that they have to deal with their crypto or token. So yes, they'll be interacting with it, but they don't need to know that they're interacting with it. That's why that UI is really, really important. This needs to be seamless. If digital healthcare tech in general, if it is too cumbersome to adopt, it will not be adopted. I used to buy digital healthcare tech for the entire health system. Not only did I put them through the security test, but I also ran them through UI test, and I tested and made sure that it was acceptable by the nurses and the physicians that would be using it. So I've sat on the other side of the table. I know what they're looking for when it comes to digital healthcare tech, and if they have to have anything to do with a cryptocurrency or token right now, it's not going to get adopted. So that's why that UI is really important. The second piece of the question was if the token if there was ever going to be an exchange with fiat and token. So we've had some early conversations with health insurance companies, exploratory conversations, about how they would actually like to use tokens to replace health insurance payments. Again, whether or not the user on the other end would know that they're interacting with and working with a token, it's too early to tell. But there are conversations that are being had in the health insurance space, specifically around reimbursement and using a token. We are pretty far from that, though. Like, let's just get through the blockchain piece.
Yeah.
Token replacing fiat in healthcare.
May I add one more thing?
Sure.
Yeah.
So it would be good to note that this is how we are approaching it. This is an open source protocol. There is nothing prevents someone from just straight up using the token and going with it. It's just for our approach to help get this adopted, we will be providing a UI. If you want to build your own app and have people only deal with the token, you're welcome to. Nothing's preventing you from doing that. That's just the approach we are taking to deal with hospitals. If you want to build a patient-facing app or a research or pharmaceutical one, you can use a token. It's entirely up to you. We just view that for day one, like Kat said, hospitals are notoriously finicky. We're trying to wade them into the pool, not like kick them into the deep.
Yeah.
No, that's the right way to do it, because there's a great analogy I read on it. It was a tweet the other day that, you don't have to know what TCP and UDP are to use Netflix. You know that Netflix runs on the internet and there's stuff in the background, but that's how this has to work, and that sounds like exactly how you guys have laid this out, so that's perfect. People keep asking about the competition, and I love that, because you said this, you're a protocol and you could build dApps on top of it, and there's a couple of other popular medical ones that I keep getting asked about. One of the newer ones that are having an ICO, that's Solve.care, and they're like a scheduling app, but that's something essentially that they this isn't to put them down or anything, but they could basically build that on top of the Health Nexus protocol. Yeah,
no, and SolveCare is an awesome company. So I know the CEO pretty well. We've been at a lot of conferences together. And he, like us, is one of the few leaders in the healthcare and blockchain space with real healthcare experience. He used to work in the government, and I'm pretty sure he has hospital administration background. But our early conversations were talking about potential ways that they could use our protocol. So yes, if they're adapt, then they could just build on the protocol.
Awesome.
Which
okay, yeah.
Source. So that makes the conversation so much easier, because it's just there. It's there for them to use.
Yep, exactly. I just wanted to make that distinction, because there's so many different, medical. They're trying to do different things, but people lump them all into the same pile of dough and think that you're gonna bake into the same thing, but that's not the case. So another one that people are asking about a lot is medical chain. I personally don't know anything about medical chain, and I don't know if you guys do either, but that's one that I keep seeing asked all over the place, and sort of how you guys maybe compare to that.
Yeah. So again, their marketing is really good. They talk about they're a dApp as well, so they could build on our protocol. But it's again lumping the same thing together, talking about data exchange and data transfer, which is a dApp that could be built on our protocol.
Awesome. Okay, perfect. All right. I think, we're going to go right into the community questions, I think. I can talk about the token sale metric stuff afterwards on my own. That's pretty straightforward stuff. Do you guys have any post-ICO marketing plans at all?
You say marketing plans?
Yeah, post-ICO, like marketing plans. Is that something that's in the works?
Oh, yeah. So I think this is something, and I've been pretty verbal, not publicly, but with our advisors and with our team and everything. This is something that I think a lot of companies don't think about, is life after token sale.
Yeah.
One thing, so something that I started to do even before I had a company was reading and podcasting on different avenues on how to run and grow a successful company. Part of that is sales and community and business development. And one of the things that was just hounded in every single podcast or book that I read is that you can never turn off a sales funnel. And that's something that we have never done. We may have turned the faucet down a little bit, but every day we're having anywhere between 3 to 4 partnership conversations, either for the Connecting Care or Health Nexus protocol. So it's something that's actively on our radar. While that's happening now, so that there's things to talk about and things to market afterwards. Healthcare sales cycles can take a bit of time. We've hacked that pretty successfully, attaining revenue within 7 months, and most of our conversations are still falling within that time frame. So yes, we're already creating the foundation for that. We already have identified people that we would be working with for that as well.
Awesome. Perfect. Okay. Let's go to the community questions, because I know that they've been stacking up, and I'll hopefully be able to pick out ones that we've answered. So I'll just skim through them really quickly here. Okay, Jamie Dodger says, hi Kat, have you had any talks with the UK NHS hospitals yet? If yes, how'd it go, and can you see your project integrating into their system?
Is a very specific question. So we have not. It's a very, very specific
You'll
market.
find that with these guys make me look smart with their questions. So yeah, you'll get some pretty specific ones, 100%.
That's awesome. So no, we haven't had a specific conversation with them, but we've had conversations with many other potential partners in other countries: Netherlands, Philippines, Mexico, Colombia, but not the UK specifically. Of course, there's an opportunity to work there. One thing you have to, I'm not sure if this is why the question was asked, but one thing you have to take into account with the UK system is GDPR, which is a specific security requirement that they're putting into place in May 2018. And there's a lot of hubbub and conversation about how blockchain is not going to work with GDPR, but it actually can. The biggest thing you have to be concerned about with GDPR is that the patient's record has to be able to be deleted, which when you talk about immutability in blockchain makes people really nervous, but Lucas touched on this already. We're not putting information on the blockchain. We're governing access to healthcare data, because one of the biggest issues is the physical transfer of data in healthcare. So if that patient's record is deleted on the silo where we're governing access to it, then it's totally fine. So there's absolutely an opportunity to work together. We have the HIPAA compliance side of it, open source protocol, and easily we can work within the GDPR guidelines.
Perfect. Okay, there's two questions kind of, and I'll lump them into one, and it's about Epic. Somebody's making reference to that they've been working with guard time apparently, and they're just wondering how that you are differentiate yourself from them, if they're a competition or if you're kind of on the same path as them. And also the next question is about Epic, that it contains 54% of the health records, and what is your plan with respect to Epic? So you kind of touched on it at the beginning, but I don't know if you have more information to share on that side of things.
Yeah, so guard time is most notoriously known in healthcare for their work in Estonia. So Estonia has now all of their electronic medical records backed up and connected to guard time. When I've researched and talked to folks about guard time, it's specifically around data provenance. Again, they're not putting medical records on the blockchain. Medical records are massive. Sometimes when people get an export of their medical record, it can be multiple hundreds pages long. So it's more around data provenance. It would make sense that Epic would be talking to guard time. The only reason that Epic would be talking to them would be probably around immutability. So securing the provenance of the records in Epic. That doesn't really affect us. We're going for a much larger play. Again, it's the Rails, it's the protocol, it's the Ethereum of healthcare that others can build dApps on top of. And so anyone could build a provenance dApp. You can use the key pair to exchange data. So not really looking in that space specifically. In terms of Epic, yes, they have the largest market share for the health system market. They're not the largest in the ambulatory market, but they do have a large market share in terms of the number of records that they maintain. Largely, that's because if you think about where the majority of people hit the healthcare system, it's usually with pregnancy, so with women. So everybody has a health record at that certain point at a hospital, because you were either a baby or a woman had her baby at the hospital, most likely. And so for that, it's interacting with Epic is as straightforward as any other electronic medical record, and same thing with Athena. It could be an API. There's really not, again, it's an augment to, it's not a replacement for any of the electronic medical records out there.
Perfect. Exactly. Yeah, that's what I like. It's sort of an augment. So it's not really affecting you guys at all. Okay. Sean asks, the U.S. healthcare system is very conservative and slow to change. How aggressively is the team planning to target systems outside the U.S. Where their efforts might be more fruitful?
Yeah, so that is a yes. So a lot of the conversations that we're having right now are with global markets. There's a couple of different ways to talk about adoption of blockchain technology. And one could argue that in some developing countries, it actually might be easier to adopt blockchain technology because you can actually use blockchain and essentially jump over 10 to 15 years of innovation and just start fresh with blockchain technology. An example of this is actually what one of our advisors, Dr. John Halamka, is doing. He's the CIO of Harvard's Beth Israel Hospital Medical Center, and they're doing work in Africa with specifically around HIV and TB, and using a certain, it's not a blockchain, it's actually a distributed hash table, but that's an example. The adoption was pretty quick. They don't even use smartphones; they use like flip phones. You remember those? And
wow.
I know. And so there's a lot of conversation and thought that adoption of blockchain tech may be faster in other countries. So we're not restricting conversation of dApps and servicing the protocol to any one specific country. I would push back on the specifics that it's hard to implement something in the States. This is where the business intelligence and the market knowledge is really, really necessary. So having spent 2 years assessing the market growth in the US and globally for the next 5 to 10 years and understanding where we're going is why we were able to attain revenue so quickly. If you have a product that people need in the healthcare system, they're going to buy it. It's just like the government, it's just like education. They have budgets for digital healthcare tech. You just have to make sure that you've created something that they actually need.
Yep, well said. Completely agree with that. Okay, so let's move on to some of the next questions. I'm sorry if I skipped some of your questions, guys, but we have to cut for time. So, are you seeing any regulation pushback anywhere at all? Any regulation roadblocks?
On the healthcare side, no. We're fine on the healthcare side.
Currently, we are good from the kind of the more crypto space finance side. What I'd say is though I won't say it's always changing environment, it's an always evolving environment. I found that to be a better term. So we're really leaning on our legal counsel at Cooley on that. Currently, we're fine and we're compliant. We don't see there being any large issues, but we always have our ear to the ground in case anything comes up so that we can move quickly. I'd say it really helps that it really has helped us a lot that we've been around for about a year and have been working on the project for a while. We have an actual code, product, and revenue stream. That has helped a lot and has pretty clearly kept us in the guidelines. But we always have our ear to the ground. So nothing right now, but constantly evolving.
Yeah, and early code from October 2016 and ideas and pitch decks from even before then, from May 2016. So this has been in the works for a while, which really helps with justification and support.
Yeah, so
for sure.
Right now, no major roadblocks, and we have really strong legal counsel that if anything comes up, they have their ears to the ground and they let us know first thing, so we can make sure we stay in the guidelines.
Awesome. So I'm seeing questions about like the MVP or prototype or whatever you want to call it, right? I guess essentially Connecting Care is already like the MVP for Health Nexus, right?
So Connecting Care is a dApp. So it'll eventually on top of the Health Nexus. So I was
going to ask that actually. It is going to move on top of the Health Nexus. Okay.
Yeah.
So in terms of the protocol itself, do you have any like an MVP is what people really are after?
So we have our stage 1 utility ready to go. That's available on our GitHub repo. Specifically, it's a DRS contract. It basically builds out that key exchange protocol as a smart contract system that's going to be launched on Ethereum. So you can use that day one. It's already been audited, so you can view the audit report on our repo. It has a wiki to go through it. We're just now also releasing a blog that will go over how to interact with it via Mist. And on the side, we're working on open source code that will be available to also help people utilize that day one. That's when we have open bandwidth though, so that comes as it comes. It's not a high priority for us, specifically the tools. But so the MVP is ready to go. You can view it on GitHub. We're privately deployed on Rinkeby right now. We're doing testing with the UI and other toolings we're building around it. So that's being tested on Rinkeby. You're welcome to download it and deploy it on Rinkeby or another testnet as well. So available on GitHub. You can go check it out there.
There you go. Okay, so it's on the testnet right now. So
yeah,
there is an MVP, guys. Okay, I'm going to move down to this question from Stocks MD. Very nice, sir. You mentioned that Health Nexus is not meant to replace any EMRs, but rather act as a bridge, excuse me, that other programs can work on. Would an example of this be something that a physician who works primarily with Epic could access the same patient's charts in another EMR like, I hope I'm saying this right, Cerner, CERNER.
That's correct. Yes, good question. Yes. So that is the whole purpose behind the key pair protocol, is to be able to open up access to healthcare data wherever it sits. It's Health Nexus, the protocol is electronic medical record agnostic. We have a third-party partnership that can help build any APIs that we need. But Connecting Care specifically is a perfect example of a DApp where the patient's information is actually aggregated. So an orthopedic physician that uses Epic then needs to share the information with another orthopedic surgeon that uses Cerner. It doesn't matter. They would be able to see the information. So the existing Connecting Care application does that. And then the Health Nexus protocol with the key pair system does the same thing.
Perfect. All right. Okay. One last question, and then I just want to talk about roadmap, and then I'll let you guys go. I know we're cutting time close here. Anthony asks, what if nodes go offline and the token holders get a lot and ransom the company? I'm not familiar with that situation.
So if the nodes go online, that's part of the HIPAA security thing. All the people on our nodes are the nodes are verified ahead of time. So it should be very unlikely for anything like that to happen. So our bigger thing would be preventing that from happening in the first place. That's that security, HIPAA grade security protocol. Part of HIPAA is making sure that if a node were to go offline, there are redundancies built into the system. That is part of it.
Okay, so you guys have thought about this then already. Okay, perfect. I just want to touch on your roadmap. Maybe just give us a quick overview of, I see phase 1 in the white paper here. Maybe just a quick rundown of that, and then I'll let you guys make a closing statement and let you off the hook here.
No problem. What was that question?
Roadmap pilot.
Phase 1 of your roadmap.
All right, so phase 1. So we already did phase 0, that was Connect Care. Phase 1 is our key exchange system launched as a smart contract service. Kind of already went into where you can go through with that. We're also working on some open source UI and backend tools for that. Those are open source though, so those kind of updates can be kind of haphazard. We're trying to hopefully get a big push in the next week or so. And then after that, we're kind of hoping we can guide the community on that development. After phase 1 though, which is the key exchange, phase 2 will be the governance and security protocol. That protocol will specifically deal with on-chain governance, specifically around upgrading the network, so ensuring the network can continue to go forward, and also securing the network. So making sure all the nodes follow HIPAA standards and whatever other security standards we determine at the time. The next phase, phase 3, that kind of goes into also what I talked about, kind of rehashing some stuff.
No, that's okay. That's like, I think phase 2 we talked about earlier, right? Where you guys moved to your own blockchain. And you're about a year ETA away from that, right?
So
okay, yeah.
All right.
That's all I wanted to make clear for people. So yeah, go ahead.
All right, sorry, try not to interrupt. I'm bad at that.
No, the delay causes some weird conversation half the time. So
yeah.
Yes, it does. So phase 3, that's when we look to deploy the network. Like I said, there's a bit of a deploy lag just because after we technically build it, we have to make sure we have enough nodes running the network, that it's like it passes compliance and other regulations. So we're deploying it somewhere around there, along with doing any additional testing that's needed. However, phase 3, the main technical thing we're going with is kind of building that key protocol or the key exchange we built up as a smart contract, building in the protocol layer to speed up efficiencies. And then the final stage, which would be about 1 year after that, that's going to be probably one of the longer stages. We're predicting that stage could go for as long as 2 years. That's when we pair decentralized storage with it. It'd be good to know that decentralized storage is in addition to available storage. So we provide an additional means of storing HIPAA compliant data securely. And it's more akin to a distributed hash table than a blockchain. And just all this stuff is kind of lumped together as blockchain tech. That's the furthest one out. It's probably the most one up in the air because we are predicting we're going to have to work very strongly with regulators and healthcare entities to kind of not necessarily prove that's HIPAA compliant, but prove that it's secure, because HIPAA compliance wasn't really built around the idea of decentralized storage. So we're predicting that one's going to take a bit. Technically it will be difficult, but we predict a large part of that stage is just going to be after building it, like showing everybody that this is okay, that it works.
Perfect.
So that,
all right. I think that's all the questions I'm going to ask you guys. I'll give you guys just a chance to make like a closing statement, and then maybe we'll have to catch up, a couple months down the road to see where you guys are at. But I'll let you make a closing statement, and then we will let you off the hook here.
Yeah, so just grateful for the opportunity to share in a live setting more about about what we're doing and what we're building. It's a little bit easier to convey the message this way. So we have a lot of content out there. I know that things move really quickly, but I think the best resource for things, if there are ever lingering questions, we get a lot of questions about our current equity investors like Yale University and MedMetrics. All those details and partnerships are in our blog. And we also kind of have a I like it because it's a less technical, more rounded approach and description of what we're building. So lots of information is out there about us. And Ryan, I really, really appreciate the nuances that you picked up about what we're building in the Health Nexus open protocol and how it differentiates itself in the space. And I think that's a really key message to drive home.
For sure. I've been looking forward to this AMA since we scheduled it like a week and a half ago, because it's not that people don't understand. Well, yeah, they don't understand, right? It's not misinformation. It's just, driving it home for people at a high level so that people can understand the differences between the DAP and the protocol, which, I'm always a huge fan of the protocols. So anyway, I will let you guys go. I appreciate you guys taking time. I know you're crazy busy, so we will definitely hopefully catch up with you later down the road. But thank you for taking your time and stopping by, guys.
Thank you.
Thank you.
Thank you.
Take care.
Bye.
Bye.
All right, guys. That was, unfortunately we had to cut it short, but I definitely have a pretty good relationship with Kat and Lucas, so I believe for sure we can get them back on again down the line, maybe after their crowd sale's over and they have some maybe technical updates. But I've been dying to do this AMA forever because I really think a lot of people are missing the big picture here, and I love that they said, and it sounds a little grandiose, I'll give you that, but the Ethereum for healthcare, right? It's a grandiose comparison, but I think it's a fair one considering what they're trying to do, and that a lot of the healthcare stuff that's out there right now can literally be built on the Health Nexus protocol. So that's where I like to go. I've said it in my Discord a million times. The premier protocols are going to attract the premier dApps. And Ethereum is a perfect example of that. So I did see something about medical chain being something similar to this. I don't know enough about medical chain to comment, but I just want to say that even though medical chain in their white paper says that it's infrastructure, you've got to look at the actual technology itself. And again, I don't know anything about medical chain, so I could be completely wrong, but I trust that they know their competition quite well, considering the healthcare space. But yeah, and Craig is talking about it right now, so it'll need clarification. And I mean, maybe there's just a lack of information on my end in there, and it's hard to say. But again, that's going to be some digging that has to be done. But I apologize again for the short AMA. I'll definitely ask to get them back on again so we can go a little deeper into it. But I know there was a lot of questions about masternodes, and it looks like they're looking to go that route, but there's some things that have to fall in place too. But it is going to be based on a proof of stake blockchain, so that's exciting. Helps secure the network, etc. Anyways, again, apologize it was so short. I wish it was longer. I'd like to talk and talk and talk, and yeah, we could have definitely talked for at least another 45 minutes if we had the time, and I apologize if I missed your questions, but there'll be plenty of chances to ask questions on the next one, or you can even go into their Telegram. I believe there's a link in the actual YouTube description below where you can ask them questions there, and I think they even have a Discord too. If we take a look at their page, I'm pretty sure, yeah, I saw a Discord link, so whatever you're comfortable with, go ahead and check things out. I'm just going to check out the questions here and see what you guys are saying. Now you have to guess whether they don't know what they're talking about or if they know something we don't know. I mean, I'm going to err on the side that they know a lot more about healthcare than we do, or at least me anyway. I would definitely not even lean close to the side that they don't know what they're talking about. I don't know anything about medical chain, guys. I should have probably researched, but I don't know anything about medical chain, to be honest with you. Val says it is a DApp. He's just reading medical chains. Oh, Naffy, thank you for modding, brother. Smash up the likes, guys. Give me the like spike. Terrible, I know. But anyway, I hope that cleared some things up for you guys. I'm personally super bullish on the project. And fair disclosure, I will be investing in this because, I mean, take a look. Premier protocols to track Premier dApps. There's no other way to say it in my book. So, all right, guys, thank you for taking the time to watch. Hopefully you got some quality information out of this. And I will catch you guys in the next one. Take care. Wrong thumbnail. Fail.